Have you ever noticed how everyone seems to be talking about Ozempic and Wegovy lately? It's not just influencers or Hollywood. It's friends, neighbors, even doctors suggesting it for weight loss. But for those of us over 60, there's one question that isn't being asked nearly enough. Are GLP-1 drugs actually safe, long-term, for older adults? If you're thinking about trying one, pause before filling that prescription. Because while these medications can do incredible things, there's a lot we still don't know, especially for people in their 60s, 70s, and beyond. Today, we're breaking down the science of what GLP-1 drugs are, how they work, what studies show about safety and side effects, and what's still missing in the research for older adults. We love that you're giving us the opportunity to help educate you about the health myths and the science that back it up. But always remember that this video is for educational purposes only and should not be taken as medical advice. Talk with your healthcare provider before starting, stopping, or changing any medication, especially if you have chronic conditions or take prescriptions. Now, let's start with the basics. GLP-1 stands for glucagon-like peptide 1. It's a hormone your body naturally produces in your gut after eating. Its main jobs are to stimulate insulin release, to lower blood sugar, suppress glucagon, to prevent your liver from releasing more sugar, slow stomach emptying, and send a signal to your brain that says, "I'm full." So when scientists created GLP-1 receptor agonists, drugs that mimic this hormone, they discovered an unexpected bonus. People lost weight, a lot of it. Medications like semaglutide, Ozempic and Wegovy, and tirzepatide, Mounjaro, and Zepbound not only helped control blood sugar and type 2 diabetes, but also led to average weight loss of 10 to 20% of body weight in clinical trials. But wait, is this a new drug? Not exactly, but the way it's being used is. GLP-1 medications have actually been around for nearly 2 decades. The first drug in this class was actually approved in 2005 for type 2 diabetes, but the perception of its limited use meant it couldn't make a big splash. Since then, newer versions like liraglutide, Victoza, later Saxenda, and semaglutide, Ozempic and Wegovy have been developed to last longer in the body and produce stronger effects. What is new is how widely they're now being prescribed for weight loss, even in people who don't have diabetes. That shift started around 2021, when the FDA approved semaglutide under the brand name Wegovy, specifically for chronic weight management. So, while the science behind GLP-1s isn't new, their popularity and use as a general weight loss tool is. And that's why researchers are still catching up on what these drugs mean for long-term health, especially in older adults. In simple terms, GLP-1 drugs tell your body to eat less and feel satisfied sooner. They also improve how your pancreas handles insulin and how your liver manages glucose. MRI brain scans even show reduced activity in appetite centers after starting GLP-1 medications. In one 2023 study in Nature Metabolism, researchers found that semaglutide changed how the brain's reward system responded to food images, and people reported less desire for high-calorie foods even after meals. That's why these medications are sometimes described as retraining the brain-gut connection. But here's where things get more complex. These studies rarely focus on older adults. Most major trials on GLP-1s include participants in their 40s and 50s, but only a small percentage over 65. For example, in the STEP trials, the major Wegovy studies, only about 7% of participants were over 65, and less than 2% were over 75. That means data for older adults, especially those with multiple medications or muscle loss, is extremely limited. So when we see claims like proven safe and effective, that statement doesn't always include older populations. And that matters because the way your body processes medication, muscle, and nutrients changes significantly with age. Everyone's body responds differently to medication. Older adults are often more sensitive to side effects and may metabolize drugs more slowly. You should never adjust dosage or frequency without professional guidance. So what do we know so far from the research? There are cardiovascular benefits. Several large studies, including the SUSTAIN-6 and SELECT trials, found that semaglutide reduces the risk of heart attacks and strokes in people with type 2 diabetes or obesity. That's a big deal, especially for those over 60 who are managing metabolic or cardiovascular risk. Participants were followed for a little over 2 years, and results showed that those taking semaglutide had a 26% lower risk of major cardiovascular events, things like heart attack, stroke, or cardiovascular death, compared to those taking a placebo. They also lost an average of 9 to 13 pounds without being on a formal weight loss plan. But here's the catch. The average age in SUSTAIN-6 was around 65, and while it included some older participants, it wasn't specifically designed to study seniors or non-diabetic adults. Still, the trial proved two key things. GLP-1s were not only helping blood sugar control, they were also protecting the heart. In conclusion, participants experienced improved blood sugar control. GLP-1s improve A1C levels, reduce insulin resistance, and may even support pancreatic health in early diabetes. Conditional weight loss maintenance. As long as you stay on the drug, the weight often stays off. But once you stop, the majority of that weight, and sometimes more, tends to return within a year. That's because the underlying biology of hunger and metabolism hasn't been permanently changed. A 2024 analysis in diabetes care found that adults over 65 on semaglutide experienced similar weight loss to younger participants, but also had higher rates of muscle loss and gastrointestinal side effects like nausea, vomiting, and dehydration. That's a concern, because maintaining lean muscle is critical after 60 for balance, metabolism, and independence. Let's look at what's still uncertain and what older adults should watch closely. First, let's take a look at muscle and bone loss. Rapid weight loss can lead to a loss of lean muscle and bone density, which increases risk of falls and frailty. A 2023 study in JAMA Network Open suggested that up to 40% of weight loss on GLP-1s may come from lean tissue, not just fat. That's why doctors recommend pairing these drugs with adequate protein intake and resistance training if cleared by your physician. How about nutrient absorption? Because GLP-1s slow digestion, some people experience reduced absorption of certain vitamins and minerals, particularly B12, iron, and fat-soluble vitamins. If you're already prone to deficiencies, this is something to monitor with lab tests. The elephant in the room, gastrointestinal issues. The most common side effects include nausea, vomiting, diarrhea, and constipation. While these often improve with time, severe dehydration or malnutrition can become serious in older adults. There is also the issue of gallbladder and pancreas concerns. GLP-1s have been linked, though not definitively, to a slightly increased risk of gallstones and pancreatitis. These are rare but potentially severe, and if you experience persistent upper abdominal pain, always seek medical care immediately. So, what are the unknown long-term effects? Here's the truth. We don't have 5 or 15-year safety data yet. GLP-1s are relatively new for widespread chronic use in people without diabetes. The first semaglutide formulation was only FDA approved for weight loss in 2021. So, while early data looks promising, long-term effects on organs, brain, and aging remain unknown. As an older adult, starting GLP-1 medication requires extra care. Start low, go slow. Dose escalation should be gradual to minimize side effects. Monitor muscle mass. Ask your doctor to check body composition, not just weight. Watch hydration and electrolytes. Slower digestion can reduce thirst cues. Track nutrition. Protein intake and resistance exercise help protect against sarcopenia. Review your medications. GLP-1s can alter absorption of other oral drugs, including blood pressure meds and thyroid hormones. And one more thing, these drugs aren't replacements for lifestyle. Even clinical trials paired GLP-1s with diet, movement, and counseling for the best results. Dr. Daniel Drucker, one of the pioneers in GLP-1 research, said in a 2024 New England Journal of Medicine review that these agents represent a powerful metabolic tool, but they must be used with caution and context, not as a cosmetic quick fix. So, should you take a GLP-1? That's not a one-size-fits-all answer. For some older adults with obesity-related conditions, it can be a game changer, improving mobility, heart health, and confidence. For others, the risk may outweigh the benefits. The key is informed decision-making. Don't just start because everyone else is. Start because the science supports it for you and your health situation. And please remember, this video is intended for general informational purposes only. It's not medical advice or a substitute for personalized care. Always talk to your doctor, pharmacist, or licensed healthcare provider before making any changes to your treatment plan. If you found this helpful, subscribe to Modern Wellness Lab for evidence-based breakdowns of trending health topics without the hype. Real talk, real wellness, real results.